Hello everyone, welcome to BioTales. Today we are going to talk about West Nile virus. West Nile virus is a potentially serious illness that is primarily spread through the bites of infected mosquitoes. The virus was first identified in the West Nile district of Uganda and has since spread to many parts of the world, including North America, Europe, Africa, the Middle East, Australia, and Asia. The majority of those infected with West Nile virus will not experience any symptoms. Approximately 1 in 5 people will develop West Nile fever. The symptoms of West Nile virus fever include headache, nausea, vomiting, fever, muscle aches, rash usually concentrated around your chest and back, diarrhea, swollen lymph nodes, sore throat, pain behind your eyes, West Nile encephalitis, and meningitis. The symptoms of more serious West Nile infections include intense, very painful headache, high fever about 103 degrees Fahrenheit or 39.5 degrees Celsius, stiff neck, you might not be able to move your chin toward your chest, muscle weakness, confusion, paralysis, muscle movements that cannot be controlled like tremors or convulsions, seizures, coma. Now we see what are the causes of West Nile virus. West Nile virus is caused by an arbovirus, specifically an RNA virus in the genus Flavivirus. This type of virus is similar to those that cause dengue fever, yellow fever, and Zika. Now we see how one can get West Nile virus. West Nile virus is primarily spread through the bites of infected mosquitoes. These mosquitoes typically contracted the virus by feeding on infected birds. The virus then multiplies inside the mosquito and it is transmitted to human or other animal when the mosquito bites them. The incubation period, which is the time between getting bitten and showing symptoms, usually ranges from 2 to 6 days but can take up to 14 days. West Nile isn't contagious. You can get it from another person who has it. In a very few cases, West Nile virus has spread from pregnant mother to their fetus, through mother milk, through a blood transfusion, through an organ transplant. There are several risk factors that are associated with West Nile virus. Certain individuals are at a high risk of developing severe illness if infected with West Nile virus. The following factors can increase the risk, that is, being over the age of 60, being an organ transplant recipient, having a cancer, having diabetes, having high blood pressure, which is also called hypertension, or having some kidney disease. There are some complications that are associated with West Nile virus. In rare cases, less than 1% of individuals infected with West Nile virus may experience severe symptoms. The most common complications include inflammation in the nervous system, such as encephalitis and meningitis. Long-term effect of a severe West Nile infection may lead to memory loss, hearing loss, difficulty walking or gait disorder, muscle weakness, abnormal reflexes, depression. Now we see how this West Nile virus can be diagnosed. If you develop symptoms of West Nile virus, especially severe ones like brain inflammation, your healthcare provider can perform tests to diagnose the infection. They may take a sample of your blood or cerebrospinal fluid to look for antibodies or other signs of the virus. Imaging testing like CT scan or MRIs may be done to check the brain inflammation. Now let's see that how the West Nile virus can be treated. There are no specific antiviral medication to treat West Nile virus. For mild cases, over-the-counter medication can help to relieve symptoms like fever and body aches. For severe neurological symptoms, hospitalization may be required for close monitoring and supportive care. This may include anti-seizure medicines for seizures, oxygen therapy or mechanical ventilation for breathing difficulties, intravenous fluid for hydration, corticosteroids to reduce brain inflammation, tube feeding if the patient cannot eat on their own. Now we look at the prognosis. In most cases, the immune system can eventually clear West Nile virus from the body. Typically, flu-like symptoms resolve on their own. However, individuals with weakened immune systems may find it challenging to eliminate the viral infection completely. Severe West Nile infections can lead to permanent nervous system damage even after the virus is no longer present. Mild symptoms of West Nile usually resolve within a few weeks, although fatigue and muscle weakness may persist for months. Following a nervous system infection, individuals may experience long-lasting or permanent issues with a memory loss, hearing loss, balance problem, and other neurological conditions. West Nile virus is fatal in about 1 out of 10 people with nervous system infections, equating to approximately 1 in 1500 individuals with West Nile. Now we see how West Nile virus can be prevented. Unfortunately, there is no vaccine to prevent West Nile virus. The best way to protect yourself is to avoid mosquito bites by staying indoors when mosquitoes are most active, especially at dawn and dusk, using EPA-registered insect repellents on exposed skin and clothing, wearing long sleeves and pants when outdoors, draining standing water around your home when mosquitoes breed, keeping doors and windows screened to prevent mosquitoes from entering your home, using mosquito netting when sleeping outdoors. Mosquitoes sometimes carry viruses that can make you sick. Fortunately, 80% of the people who have West Nile never develop symptoms, and most people's risk of getting seriously ill is very low. If you might be around mosquitoes, you can take steps to protect yourself from their bites. If you do get bitten, see a healthcare provider if you develop symptoms of West Nile. They can help you understand what serious symptoms to look out for and answer any question you have. Thank you.